Hi, my name is Rachel McCoy, and I am a part of the team of VaxFacts, which includes Alexis, Abigail, and Kayla. And our project aimed to look at COVID-19 vaccine dissemination strategies, looking to improve vaccine delivery and adherence, ensuring the greater public health service across the United States.
So I'm going to be discussing the different strategies that Florida and New Hampshire used to deliver vaccines. So beginning Monday, April 5th, all Florida residents 18 years of age and older were eligible to receive any COVID-19 vaccine as prescribed by the FDA. Florida officials reported that they chose public stores for vaccination rollout because the chain has so many stores in the state and was considered at the time to be better prepared than other retailers. So a study found, using a multivariate analysis, strong associations between the number of vaccination sites and a zip code and race and ethnicity, and a weaker association with percentage of residents at or below the poverty line. So they identified hotspots or areas with greater vaccine availability in moderately populated areas where the population was significantly older, richer, and whiter than in areas of lower vaccine availability. DeSantis also faced questions over his decision to provide seniors living in two of Manatee County's wealthiest zip codes with special access to the vaccine. DeSantis said that the state is focusing on communities with a high concentration of seniors that are willing to help organize vaccination events, and Manatee County has tailored other parts of the state in vaccinating residents 65 and older. As for New Hampshire, all New Hampshire residents aged 16 and older were able to register for COVID vaccine appointments by the end of the week, April 2nd. This is all 2021. The state strategy for distribution is tailored for rural versus urban, and vaccine supplies coming into the state determine how much each county is allocated. New Hampshire has taken part in the Federal Pharmacy Partnership Program, which is a collaboration connecting national pharmacy partners and independent pharmacy networks with the federal government and states to increase COVID-19 vaccines across the US. And this is according to the CDC website. As of now, they have a 92% vaccination rate in urban areas and a 91% vaccination rate in rural areas, compared to Florida, which has a 77% vaccination rate in urban areas and a 55% vaccination rate in rural areas. Many community and health organizations in New Hampshire are shifting their vaccination efforts to the micro level, knocking on doors and trying to go where the people are. They say the most successful efforts now are those that focus on building trust and answering one-on-one questions. The Nashua Division of Public Health and Community Services director said her department is focusing on continuing to send people out into the community to do on-site vaccinations, including at places like barbershops and other soup kitchens. 10% of the vaccines that came into the state were allocated to a population of minorities and individuals who are homeless, have language barriers, or they had transportation barriers or impacted disproportionately by the infection. As of November 2021, the Executive Council reversed its earlier rejection of the $22.5 million in federal aid for immunization work. So as you can see, Florida and New Hampshire had very different strategies to vaccine dissemination.
Hello everybody, my name is Alexis, and I would first like to talk about New Hampshire's strengths when it comes to vaccine dissemination. They were successful in getting a large part of their population vaccinated under Governor Chris Sununu because they provided resources about the COVID vaccine to residents and also helped them complete their vaccine registration if they choose to do so. As Kayla also mentioned, they allotted 10% of the vaccines in their state to go towards vaccinating the houseless community as well as other minority groups that may face barriers to getting the vaccine. In providing these resources, they not only made citizens more comfortable about the vaccine, but they also decreased barriers to getting it. For Florida, Governor Ron DeSantis made the right decision to prioritize the elderly population when it comes to vaccine dissemination. This was validated in a report by U.S. Department of Health and Human Services released in late 2021, stating that the Senior First policy led to a greater number of lives saved than it would have had we prioritized a younger population.
Let's look at the weaknesses from each state, starting with Florida. First, we saw that there was a lack of transparency. According to the editorial board of the Treasure Coast, in January 2021, Governor Ron DeSantis has favored a hands-off decentralized approach. Florida required individuals to call or visit the website of their individual county to sign up for information and alerts that would eventually allow them to register for a vaccine when it became available. Counties with high population concentrations became overwhelmed by demand, forcing counties like St. Lucie to utilize online ticketing, while other counties used traditional calling measures. There was no consistency across counties. Second was vaccine tourism. The same editorial board found that Florida faced the challenge of vaccine tourism as residents were not required to register themselves in their local county, meaning they could travel throughout the state to get the vaccine wherever it was readily available. This left local residents without their dose. Finally, there was inequity between socioeconomic groups, which we alluded to earlier within the presentation. According to a study conducted by FAU, spatial clustering analysis of Publix vaccination sites per 100,000 people found greater vaccine availability in moderately populated areas where residents were significantly older, richer, and whiter than in cold spots or areas of lower vaccine availability. The study revealed cold spots existed in areas containing Hispanic residents and a higher number of single-parent households, such as inner-city Miami-Dade County and inland rural regions of Florida. This is a huge issue because our aim is to ensure the greater public health service. And if there is inequity and inequality among socioeconomic groups, among racial groups, that is a huge issue that needs to be addressed in the future. Now let's look at New Hampshire. First, we saw there were technical issues in scheduling appointments. Constituents experienced issues with scheduling their second dose. And these technical issues were faced largely because scheduling occurred through one website, which faced crashes and lagging as there were a large demand of individuals trying to schedule a vaccine dose. Unfortunately, many of those registering were elderly, and that caused a lot of anxiety and frustration among the population. Finally, there was cases of inaccurate reporting. Casey McDermott of NPR in June 2021 found that data reporting errors may have inflated vaccine progress within New Hampshire, as New Hampshire faced many data errors stemming from the program distributing vaccinations through pharmacies. Pharmacies were reporting their data back to the state as well as the federal government, resulting in duplicate counts. Inaccurate data can have a dire consequence, such as changing the supply of vaccines, given the assumption that much of the population has already received their doses. In addition, inaccurate data can also lead to policy changes, such as more lenient social distancing or masking, when these measures at the time are really, really crucial and still necessary.
Hi, my name is Abigail, and I will be discussing some solutions and best practices from New Hampshire that Florida can implement to increase COVID vaccination rates. For Florida to get higher vaccination rates, it can adopt a few key practices that New Hampshire has. For instance, New Hampshire has made efforts to ensure that vaccines were made accessible to underserved populations. For over $1 million was federally funded and went towards vaccine education and hiring workers to reach vulnerable communities. In Florida, a study was conducted throughout the state and found that vaccination sites were weakly associated with very low-income individuals, creating unequal access to vaccines. Florida should consider allocating more funding for vaccine sites to reach those areas that lack the means to acquire them. In addition to making vaccines more accessible, Florida can start promoting vaccines through TV ads like New Hampshire does. New Hampshire utilized over $1 million to fund 2 digital marketing ads for COVID vaccines. The first ad campaign received a lot of traction on social media with 500,000 views. The second ad campaign is aimed to target individuals under 40 in counties with lower vaccination rates and in areas that lack access to healthcare. Florida seems to be doing the opposite. Florida has been promoting vaccinations through TV ads, but now vaccine ads simply just show images of the vaccines without explicitly mentioning them anymore. This can leave people unsure about the message of the advertisement and might not encourage them to get vaccinated. There should be a clear and informative message that the ads communicate, and they should be geared towards the population that are skeptical about receiving the COVID vaccines. New Hampshire's Governor, Chris Sununu, publicly supports vaccines and encourages residents to get them. Seeing the leader of a state advocate for something encourages its residents to support that thing as well. A strength that Sununu demonstrates is encouraging vaccines, but not forcing them. So as President Biden was pushing for mask mandate, Sununu was against that, but was for influencing people within their will to get vaccinated, which likely led to the high vaccination rates that we see in New Hampshire. Florida's Governor, Ron DeSantis, does not motivate Floridians to get vaccinated, but heavily supports not mandating vaccinations for Florida jobs. Now, while it's important to support autonomy, it is crucial to encourage practices that protect the public against COVID-19, which DeSantis has failed to do. An effective way for more Floridians to be less doubtful about vaccines is for the governor to encourage them. Using a situational leadership model, leadership officials in New Hampshire have taken a more hands-on approach and are supporting residents with vaccinations as more resources such as education and distribution of vaccines are made available to the public, and leaves the choice up to them to decide whether to get vaccinated or not. After all its efforts, New Hampshire has the highest vaccination rates in the US, so its strategies are effective and could be applied to Florida's vaccination promotion tactics.